Hi, this is Beth Helton from Northwest Brain Injury Center, and I'm presenting a poster today called Help Me Cry Again. It's a post-stroke case study. This poster was originally presented at the ACRM annual conference in 2019. The primary author of this poster was Neumann, PhD. I was the presenter. We also had help with getting some assessments done by Teresa, Cochran, and we thank Dr. Carbone for providing this patient for us. This is the poster that we presented at ACRM. It's up on the wall at NBIC, and if anybody wants to kind of take a look at it, they're welcome to come and see it. This program was originally developed by Neumann and colleagues. It's a therapeutic approach to explore changes in the ability to express emotions, perceive emotions in self and in others. It uses a variety of slides in which a patient is asked to identify one of four emotions being shown, to identify when these emotions have occurred in their own past in order to elicit demonstrable emotions in themselves. The goals of this program include attending to facial features relating to others' emotions through their own emotional experiences. Patients are asked to identify facial expressions showing happiness, sadness, anger, and fear. Photos also include obvious and subtle expressions of these four emotions. Patients are asked to describe specific facial features that help them identify which emotion is being expressed. Then they imitate the expression using a mirror. As they continue to progress through the program, they are asked to describe specific situations in which they experienced each of the four emotions. Then they describe physiologic sensations they experienced during the situation. The other person's reactions are also discussed. The objectives of this study, or the past research with this study, were with patients who had reported had TBI, reporting the inability to cry after their injury, causing impaired emotions, perception, and reporting crying for the first time after receiving this facial affect recognition intervention being used in the study. This intervention elicits personal emotions which may facilitate crying. This intervention was used in a case study of a woman that reported she was unable to cry after her stroke. She was a 68-year-old female. She was status post subarachnoid hemorrhage of the right anterior communicating artery due to aneurysm rupture. She was also status post coiling. She had completed traditional speech therapy for her cognitive issues, and she was referred by her physiatrist, Dr. Carbone, with complaints of not being able to cry since her stroke. There are no current standards of treatment options for this problem, and she was on no medications for mood. Her complaints included not being able to cry, even at times when she wanted to, the marriage of her daughter, the birth of a grandson, and the loss of a friend. She also stated that she felt like she had an emotional disconnect since her aneurysm. The patient was assessed with 3 different evaluations plus an observation of her affect expression and crying. The social cognition portion of the assessment was from the WACE, and that includes facial affect naming, which is matching photos to one of 8 listed emotions. Prosody face matching, where you're matching a photo with verbally stated comments attending to the prosody. For example, that was really good, or he left me again. Prosody pair matching was also used to determine if the way a statement portrays the actual meaning. For example, I can really count on him, or thanks for your help. These scores were combined to find the overall social perception score. The Toronto alexithymia scale was used to assess difficulty identifying feelings, describing feelings, and externally oriented thinking. Our patient was assessed with these evaluations as a pre-test 1 and 2. Then she completed the facial affect recognition program with an immediate post-test. She initially presented with an overall normal social perception, but poor emotional insight on the TAS and depression. She completed 7 one-hour sessions using the facial affect recognition delivered by a speech therapist after the initial evaluations. Activities included identifying facial expressions, imitating emotions, discussing personal emotional responses or experiences, and describing physiologic changes with emotional responses. Working through the program was very emotionally intense at times, with the patient sharing personal situations and details when she experienced these emotions, each of these 4 target emotions. She also shared with me that she often heard her mother's voice in her head telling her not to cry, to be strong. I asked her to give herself permission to not listen to those thoughts, which she was able to do, and enabled her to more reflect and be able to release these feelings. She was able to observe changes in herself with both reactions to situations as well as physiologic signs of emotion. These included a lump in her throat, heaviness in her chest, the ability to shed tears. Others also noticed an increased facial expression in her, including laughing more often. It was thought that her inability to cry was likely associated with the alexithymia, especially her lack of attention to emotions. Her scores on the TAS decreased from moderate to low from the initial assessment to the post-test. The facial affect recognition helped her to attend to and connect with her emotions through imitation and personal experience. She had shed tears 3 times by the end of the treatment. Her scores from alexithymia improved from moderate to low. Being the therapist that helped her with this, as I said, it was a very emotionally impactful time. She shared many instances of personal experiences, and I think that helped her to be able to reconnect with her emotions. And as I said, others also had gave her positive statements about her just overall emotional affect after her treatment.